If you decide that breast implants are the best for you, there are still some considerations to make. You need to choose between silicone or saline implants. You and your surgeon also need to discuss the type of incision to be used during surgery, as well as the location of the implants within the breast cavity. Incision techniques. There are 4 incision techniques used to put breast implants in place. The type of incision determines how noticeable scarring is and whether or not you'll be able to breastfeed after surgery. Periareolar incision. Ideally, this incision is made between the darker tissue of the nipple and the lighter tissue of the breast, so the scar is less noticeable. It provides the surgeon with excellent control over the placement of the breast implant. Surgeons can easily manipulate the implant and put it in the appropriate area inside the breast. Transaxillary incision. This incision is made in the armpit, where the arm and chest fold together. The implant is then carefully guided through the tissue to be positioned behind the nipple. One of the biggest advantages this type of incision has is that it leaves almost no noticeable scars. Inframammary incision. This incision is placed in the fold under the breast, making it less noticeable. The surgeon then slides the breast implant up into position under the nipple. This type of incision gives surgeons superior control in terms of manipulating the implant into the correct position. Tuba incision. This incision is made in the belly button. It is only used for saline implants because the deflated implant can be moved up into the breast from the navel with the help of an endoscope. The advantage of this type of incision is that there are no scars. It can be difficult for surgeons to get implants into their correct position, and some women end up with asymmetrical breasts. Location of implants. The location of implants inside the breast plays a significant role on how natural they look once in place. Talk with your surgeon about your situation to determine which implant location would be most suitable for you. Subglandular. The breast implants are positioned between the glands in the breast tissue and the pectoralis major muscle. This site is where normal breast tissue is located, and in most cases, this placement offers the most natural-looking results. Subfacial. This involves positioning the implants under the fascia of the pectoralis major muscle. Some surgeons believe that subfacial placements offer better coverage of the implant and helps to keep it from moving. Subpectoral. After the release of certain muscle attachments, the implants are placed under the pectoralis major muscle. The implant is only positioned partially beneath the pectoralis major. The lower portion of the implant lies within the subglandular area of the breast. Submuscular. The whole implant is placed under the pectoralis major muscle. Note that in the subpectoral position, only half of the implant is beneath the pectoralis major. Some chest wall muscles must be released in order to place the implants in this position. Types of breast implants. Aside from the incision techniques and the location of the implants, you'll also need to discuss with your surgeon the type of implants you wish to use to increase the size of your breasts. Silicone implants. As the name suggests, these are filled with silicone gel. These feel like human fat, and a lot of women believe that silicone implants provide a more natural look and feel. Saline implants. These are normally inserted into the breast, deflated, and once in position they can be filled with saline. The advantage of having saline implants is that there is less risk if they leak or rupture. Some women also noted that saline implants can feel hard and look unnatural. However, surgeons can place the saline implant behind the pectoralis major muscle to address these problems. Gummy bear implants. These are made of cohesive silicone gel, which is a substance that can be molded into a more natural breast shape. As compared to silicone implants, these are less likely to rupture and leak into surrounding tissues. Comparison and contrast of boob implants. In general, saline implants are safer than silicone implants because if they leak or rupture, the saline fluid will simply be absorbed by the body without posing any health risks. Women with saline implants know almost immediately if their implant has ruptured, while those with silicone implants must commit to having an MRI performed at least once every 3 years to ensure that their implants are still intact. Gummy bear implants are relatively new, having been approved by the FDA in the United States just recently. They are more expensive than saline or regular silicone implants. They are less likely to rupture than silicone implants, and they provide a more natural look and feel than saline. However, they can look unnatural if they move out of position. Click Next to learn about the cost of a boob job.